Now we'll quickly look at yet another classification of drugs. Okay, so these are basically drugs that could be used for, on the skin. So I'm using these drugs to basically, treat skin related conditions. So they call them dermatological medications. So just quickly, let me get my pen. So for the dermatological medications, these are some skin conditions: the eczema, the urticaria, the psoriasis, the lichen planus, the bruises, the pityriasis, the acne, the vitiligo, a lot of them. So when you say dermatological medications, they are just drugs used in treating skin conditions like we listed: acne, eczema, psoriasis, infections, allergic reactions, and a lot of them. More than 100 skin issues, So these drugs, they could be applied directly to the skin when you're actually saying that the issue is just localized at that place. But if the issue on the skin is a systemic issue, you can also put them orally into the system. If I'm applying it on the skin, it's topical administration, So examples, we have the topical ones like the hydrocortisones, the topical ones like the hydrocortisone, the betamethasone, the triamcinolone, mainly used in reducing all those inflammation, itching, redness in eczema, dermatitis, also psoriasis. Also, long-term use may actually reduce the thickness of your skin. That's usually the disadvantage. You also have the creams that women rub, so that you see a lot of women, they don't really like to go under the skin because their skin is thick and the sun affects them so much. Okay, then we have antibacterials like Mupirocin, the Clindamycin, they treat bacterial infections like all those Impetigo, Acne. They are generally safe, but they can also cause some irritations. We have the ones that could be used in treating fungal infections like the Clotrimazole, the Terbinafine, the Ketoconazole, using to treat those ringworm, left foot, candidiasis, So also have the antivirals. Okay, examples like the Valacyclovir, the Valacyclovir, they treat all those viral related infections. Then we have the retinoids like the Tretinoin, Isotretinoin, used to treat all these acne issues, anti-aging issues, and psoriasis. Okay. So have the immunomodulators. These ones are basically given if it is suspected that is your immune system that is overacting. Do you understand? So I've given some drugs that will basically keep the immune system on the solo, like the tacrolimus, also the pimecrolimus. So also sometimes coal tar and antraline, mainly used for psoriasis treatment, can also be used. Okay, so this is just an introductory lecture to it. We'll come back and talk about each of these drugs later on.